confuses many people: skincare ingredient lists. Learning to read and understand product labels empowers you to make informed choices about what you put on your skin. Looking at an ingredient list can feel overwhelming. There are long chemical names, unfamiliar terms, and dozens of ingredients in a single product. But with some basic knowledge, you can decode these lists and understand what you're actually applying to your skin. Let's start with how ingredient lists are structured, because this gives you immediate valuable information. In most countries, including the United States, ingredients must be listed in descending order by concentration. The first ingredient is present in the highest amount, the second ingredient is second most abundant, and so on. This continues until you reach concentrations below 1%, at which point ingredients can be listed in any order. This means the first 5 to 7 ingredients typically make up the bulk of the product's formula. These are the ingredients that will have the most impact on how the product performs and how your skin responds to it. Let's look at a hypothetical ingredient list: water, glycerin, cetearyl alcohol, niacinamide, hyaluronic acid, ceramides, preservatives, fragrance. Water is the first ingredient, meaning this is primarily a water-based product. Water is an extremely common base for skincare products. It's inexpensive, a good solvent for many ingredients, and helps products spread easily. Glycerin is second, which tells you this is a hydrating product. Glycerin is a humectant that attracts moisture to your skin. Cetearyl alcohol is third. Despite the name alcohol, this is actually a fatty alcohol that acts as an emollient and thickener. It's moisturizing, not drying. Don't confuse fatty alcohols like cetearyl alcohol with drying alcohols like denatured alcohol or SD alcohol. Niacinamide appearing fourth means it's present in a meaningful concentration. This product will likely provide niacinamide's benefits: calming inflammation, regulating oil, fading dark spots, and strengthening your barrier. You can see how reading even just the first few ingredients tells you a lot about what the product is and what it's designed to do. Now let's discuss categories of ingredients and what to look for. Humectants attract and hold water. These are crucial for hydration. Common humectants include glycerin, hyaluronic acid, sodium hyaluronate, aloe vera, honey, panthenol, provitamin B5, and propylene glycol. If you want a hydrating product, look for humectants high on the ingredient list. Emollients fill in the spaces between skin cells, creating smooth, soft skin and helping repair your barrier. Common emollients include ceramides, cholesterol, fatty acids, squalane, jojoba oil, shea butter, and various plant oils. If your skin is dry, rough, or sensitive, emollients should be prominent in your products. Occlusives create a protective layer on your skin's surface that prevents water loss. Common occlusives include petrolatum, mineral oil, dimethicone, beeswax, and lanolin. Very dry skin benefits from products with occlusives, especially at night. They're the seal that locks in all the hydration and treatment ingredients beneath them. Antioxidants protect your skin from free radical damage caused by UV exposure, pollution, and normal metabolism. Common antioxidants include vitamin C, L-ascorbic acid, ascorbyl palmitate, magnesium ascorbyl phosphate, vitamin E, tocopherol, niacinamide, vitamin B3, green tea extract, resveratrol, and coenzyme Q10. Look for antioxidants in daytime products, especially when your skin faces environmental stressors. Exfoliants help remove dead skin cells and improve texture. We have AHAs like glycolic acid and lactic acid, water-soluble surface exfoliants, BHAs like salicylic acid, oil-soluble, penetrates pores, and enzymes like papain and bromelain, gentle protein dissolvers. Exfoliants typically appear lower on ingredient lists because they're effective at low concentrations, usually between 0.5% and 10%. Retinoids increase cell turnover, boost collagen, and prevent clogged pores. You might see retinol, retinol palmitate, retinaldehyde, or if prescription, tretinoin. These are powerful ingredients that appear effective even at low concentrations. Peptides are chains of amino acids that signal your skin to perform certain functions, often related to collagen production. Look for matrixyl, copper peptides, palmitoyl pentapeptide, and various other peptides. The science on peptides is still evolving, but many people find them helpful for firmness and texture. Now let's talk about ingredients you might want to avoid or be cautious with. Fragrances can cause irritation and allergic reactions. Fragrance is one of the most common causes of contact dermatitis. If you have sensitive skin or are prone to reactions, fragrance-free products are safer. Note that fragrance or parfum on an ingredient list can represent dozens of different chemicals, and companies aren't required to disclose what specific compounds they're using. Natural fragrances from essential oils can also be irritating, despite being natural. Citrus oils, peppermint, eucalyptus, and many others can cause sensitivity. Natural doesn't automatically mean gentle. Drying alcohols like alcohol denat, SD alcohol, and isopropyl alcohol can strip your skin and cause irritation, especially in high concentrations or with prolonged use. However, small amounts in a formula might not be problematic, and they serve purposes like helping products dry quickly or penetrate better. Context and concentration matter. Sulfates like sodium lauryl sulfate, SLS, and sodium laureth sulfate, SLES, are cleansing agents that can be harsh and stripping, especially for dry or sensitive skin. Many people prefer gentler cleansing agents like cocamidopropyl betaine or sodium cocoyl isethionate. Parabens are preservatives that prevent bacterial and fungal growth in products. They've been controversial due to concerns about hormone disruption, though research hasn't definitively proven harm at the concentrations used in cosmetics. If you prefer to avoid them, many products now use alternative preservatives like phenoxyethanol or sodium benzoate. That said, preservatives themselves are important. Products containing water need preservatives to prevent dangerous bacterial and mold growth. Preservative-free products must be packaged carefully in airless pumps and used quickly after opening. Let's discuss concentration. An ingredient appearing on a label doesn't guarantee effectiveness. Concentration matters tremendously. For instance, if vitamin C appears near the end of a long ingredient list, it might be present only in trace amounts for marketing purposes. This is sometimes called fairy dusting, adding trendy ingredients in tiny amounts that won't actually provide benefits just so they can appear on the label. For key active ingredients, you want to see them high enough on the list to indicate meaningful concentrations. If you're buying a niacinamide product, niacinamide should appear within the first 7 ingredients or so, not tucked away at the end. Effective concentrations vary by ingredient. For example, niacinamide is effective at 2 to 5%, vitamin C at 10 to 20%, retinol at 0.25 to 1%, and hyaluronic acid at 0.1 to 2%. You often can't tell exact percentages from ingredient lists, but position gives you a hint. Let's talk about buzzwords and marketing claims because these can be misleading. Clean beauty has no legal definition. What one brand calls clean might differ entirely from another brand's definition. Clean doesn't automatically mean safer or more effective. Judge products by their actual ingredients and how they perform for your skin, not by marketing labels. Natural and organic also aren't automatically better. Some natural ingredients are wonderful for skin. Others can be irritating or ineffective. Some synthetic ingredients are extremely effective and safe. What matters is how an ingredient works for your skin, not whether it came from a plant or a lab. Dermatologist tested sounds impressive, but means very little. It might mean one dermatologist used the product once. It doesn't guarantee effectiveness or safety. Similarly, clinically tested can mean almost anything. The testing might have been minimal or poorly designed. Hypoallergenic suggests a product is less likely to cause allergic reactions, but there's no standard for this term. It's largely marketing. If you have allergies, check the actual ingredient list. Non-comedogenic means less likely to clog pores, but again, there's no standard testing or definition. What clogs pores can be individual. An ingredient that's fine for you might cause breakouts in someone else. Let's discuss how to approach trying new products safely. First, identify your skin's sensitivities. If you know certain ingredients cause reactions, check labels carefully and avoid products containing them. Keep a note in your phone of ingredients you react to so you can reference it when shopping. Second, patch test if you're concerned about reactions. Apply a small amount of the new product to your inner forearm or behind your ear and wait 24 to 48 hours. If no reaction occurs, try it on a small area of your face. If all is well after a few days, proceed with full use. Third, introduce one new product at a time and wait at least a week before adding another. This way, if you have a reaction, you'll know which product caused it. Fourth, remember that expensive doesn't mean better. A drugstore product with good ingredients can work just as well as a luxury product. Judge products by their formulations, not their price tags. Reading reviews can be helpful, but take them with perspective. Skincare is highly individual. A product that's life-changing for one person might break out another person. Reviews can indicate general quality and experience, but your own skin is the ultimate judge. As we close our time together, remember that becoming ingredient savvy is empowering. You don't need to memorize every chemical name or become a cosmetic chemist, but understanding the basics, how to read an ingredient list, what major categories of ingredients do, what to look for, and what to be cautious of, helps you make informed choices. Your skin deserves products that truly serve its needs, not just products with clever marketing. By learning to read labels, you become a more informed consumer and a better advocate for your own skin health. Take a deep breath in and out. You now have the tools to decode ingredient lists and choose products wisely. May you find products that truly benefit your skin. May you feel empowered in your choices. May you trust your growing knowledge and your skin's feedback. Thank you for this time together. Be well and choose wisely. Welcome to this tranquil moment of rest and learning. Take a deep, slow breath in, filling yourself with calm. Release it gently, letting any tension flow out of your body. Today we're going to explore one of the most powerful yet often overlooked aspects of skincare: sleep, and how the quality of your rest profoundly shapes the health and appearance of your skin. Sleep is not a luxury. It's not wasted time or something to sacrifice when life gets busy. Sleep is when your body performs its most essential repair and regeneration work, and your skin is no exception. In fact, the connection between sleep quality and skin health is so strong that you can often tell how well someone is sleeping simply by looking at their face. Let's explore this beautiful restorative relationship between sleep and skin. Every night as you drift into sleep, your body enters a different state. Your conscious mind rests, but your body becomes extraordinarily active in ways that don't happen during waking hours. This is when healing happens. This is when cells regenerate. This is when your skin performs its most important maintenance work. Without adequate, quality sleep, no amount of expensive skincare products can fully compensate. Let's understand what happens to your skin during sleep, hour by hour, cycle by cycle. When you first fall asleep and enter the early stages of sleep, your body begins shifting resources. Blood flow increases to your skin, delivering oxygen and nutrients that support cellular function. Your body temperature drops slightly, which is optimal for certain repair processes. Your stress hormone levels, particularly cortisol, begin to decline. This decrease in cortisol is crucial. High cortisol levels are inflammatory and damaging to skin, so nighttime is when your skin gets relief from daily stress. As you move into deeper stages of sleep, growth hormone is released. This hormone is essential for tissue repair and cell regeneration. Growth hormone stimulates collagen production, the protein that keeps your skin firm and smooth. It supports the repair of damage accumulated during the day from UV exposure, pollution, and general wear. Without adequate deep sleep, growth hormone release is impaired, and these crucial repair processes suffer. During the deepest stages of sleep, your skin's cell turnover accelerates. Old damaged cells are shed more rapidly, and new cells are produced. This is why sleep is sometimes called beauty sleep. You literally wake up with fresher, newer skin cells than you went to bed with, assuming you sleep well. Throughout the night, your skin also works on repairing its barrier function. The lipid matrix that forms your skin's protective barrier is replenished. Transepidermal water loss, the rate at which moisture escapes from your skin, is at its lowest during sleep, allowing your skin to retain hydration more effectively. This is why your skin often feels more plump and hydrated in the morning after a good night's sleep. Your body's melatonin levels rise during sleep. Melatonin isn't just a sleep hormone, it's also a powerful antioxidant that protects your skin cells from damage and supports repair processes. This natural antioxidant surge during sleep is one of your skin's primary defense mechanisms against aging and damage. Now let's explore what happens when you don't get adequate or quality sleep. Sleep deprivation has immediate, visible effects on your skin. After just one night of poor sleep, you might notice your skin looks duller and paler. This happens because inadequate sleep reduces blood flow to your skin. Dark circles under your eyes become more prominent as fluid accumulates, and blood vessels become more visible through your thin under-eye skin. Your skin may look more lined and aged after poor sleep because dehydration and lack of plumpness make fine lines more visible. You might notice your complexion is uneven or sallow because cellular turnover was impaired. Your skin may feel rougher or look patchier because barrier repair was incomplete. Chronic sleep deprivation, consistently getting less than 7 hours, or sleeping poorly night after night, creates cumulative damage that accelerates aging and worsens virtually every skin concern. Without adequate growth hormone release, collagen production decreases. Your skin loses elasticity and firmness more quickly. Fine lines deepen into wrinkles. Skin starts to sag earlier than it would with proper sleep. Elevated cortisol from sleep deprivation increases inflammation throughout your body, including your skin. This inflammation can trigger or worsen acne, rosacea, eczema, psoriasis, and other inflammatory conditions. It makes your skin more sensitive and reactive. It impairs healing, so any skin issues take longer to resolve. Poor sleep disrupts your immune system function, making your skin more vulnerable to infections and less able to fight acne-causing bacteria. Breakouts become more frequent and severe. Your skin's ability to protect itself from environmental stressors weakens. Sleep deprivation also affects your skin's moisture balance. Your skin loses more water when you're sleep deprived, leading to dehydration. At the same time, your skin may produce more oil as cortisol levels rise, creating that frustrating combination of dry, dehydrated skin that's also oily. The visible signs of chronic sleep deprivation accumulate over time: premature aging, persistent dark circles, dull complexion, increased breakouts, sensitivity, uneven tone, and skin that simply doesn't respond well to products or treatments. Your skin looks tired because you are tired, and no concealer or serum can fully disguise that. Beyond just duration, sleep quality matters enormously. You can spend 8 hours in bed but still not get truly restorative sleep if your sleep is disrupted, shallow, or fragmented. Deep sleep, also called slow-wave sleep, is when most of the skin-beneficial processes occur. Growth hormone is released primarily during deep sleep. If you're not reaching adequate deep sleep, perhaps because of stress, sleep disorders, alcohol consumption, or poor sleep habits, your skin misses out on crucial repair time even if you're in bed long enough. REM sleep, while different from deep sleep, is also important for overall health and stress management. Poor REM sleep often means poor emotional regulation and increased stress, which indirectly affects your skin through the stress-inflammation pathway. Sleep quality is affected by many factors: stress and anxiety, an uncomfortable sleep environment, irregular sleep schedule, caffeine or alcohol consumption, screen time before bed, underlying sleep disorders like apnea, pain or discomfort, and medications that interfere with sleep architecture. So how do you improve your sleep quality for the sake of your skin and your overall well-being? Let's explore practical, effective strategies. First, prioritize sleep by treating it as the essential health practice it is, not as optional or expendable. Aim for 7 to 9 hours nightly for most adults. Some people need slightly more, some slightly less, but most people need at least 7 hours for optimal health and skin benefits. Calculate what time you need to be asleep, not just in bed, but actually asleep, to get your target hours before you need to wake up and protect that sleep window. Create a sleep-conducive environment. Your bedroom should be dark. Even small amounts of light can disrupt sleep quality. Use blackout curtains or an eye mask if needed. It should be cool. Most people sleep best in temperatures between 60–67 degrees. Welcome. and take a moment to simply be here. Breathe in deeply, filling your lungs completely, and then release that breath slowly, letting any tension dissolve. Today we're going to explore something beautifully fundamental: how hydration transforms your skin from the inside out and the outside in. Water is life. This isn't just poetic language, it's biological truth. Your body is approximately 60% water. Your skin, the largest organ of your body, is about 64% water. Every cell, every function, every process in your skin depends on adequate hydration. When your skin is well hydrated, everything works better. When it's dehydrated, everything struggles. Let's begin by understanding what we mean by skin hydration and why it matters so profoundly. Hydration refers to the water content in your skin cells. Well-hydrated skin cells are plump, full, and functioning optimally. They communicate properly with each other, turn over at the right rate, and maintain the structural integrity of your skin. Dehydrated skin cells become shriveled, sluggish, and compromised. They can't perform their jobs effectively. Here's something many people don't realize. Hydration and moisture are related but different. Hydration is water. Moisture includes both water and oils that help seal that water into your skin. Your skin needs both. You can have oily skin that's dehydrated, producing plenty of sebum but lacking water. Understanding this distinction changes everything about how you care for your skin. When your skin is properly hydrated, you'll notice it immediately in how your skin looks, feels, and behaves. Hydrated skin has a natural luminosity, a subtle glow that no highlighter can replicate. It feels soft and supple to the touch, comfortable throughout the day. It looks plump and smooth, with fine lines less visible. It heals faster from irritation or blemishes. It maintains its barrier function effectively, protecting you from environmental stressors and irritants. Dehydrated skin, in contrast, looks dull and tired. It may feel tight, especially after cleansing. It shows fine lines more prominently, even if you're young. It may be flaky or rough in texture. It's more sensitive and reactive, becoming easily irritated by products that normally wouldn't bother it. It may even produce more oil as your skin tries to compensate for the lack of water. Now let's explore hydration from two essential angles: hydrating your skin from within through what you consume, and hydrating your skin from without through the products you apply. Let's start with internal hydration, drinking water and supporting your body's hydration from the inside. Your skin receives water from your bloodstream. When you're well hydrated internally, your blood delivers water to your skin cells effectively. When you're dehydrated, your body prioritizes vital organs over your skin. So your skin is often the first place you'll notice dehydration. How much water should you drink? The old rule of 8 glasses a day is a reasonable guideline, but it's not one size fits all. Your needs depend on your body size, activity level, climate, and diet. A better approach is to drink water consistently throughout the day and pay attention to your body's signals. Your urine color is a simple indicator. Pale yellow suggests good hydration, while dark yellow indicates you need more water. Your thirst is another signal, though by the time you feel thirsty, you're already mildly dehydrated. Don't wait for thirst. Sip water regularly. Create habits that support consistent water intake. Keep water visible and accessible. Have a glass of water when you wake up, before each meal, and before bed. Carry a water bottle with you. Set gentle reminders if needed. The goal isn't to force excessive amounts, it's to maintain steady, adequate hydration throughout the day. Coffee and tea count toward your fluid intake, though caffeinated beverages have a mild diuretic effect. You don't need to avoid them, but balance them with plain water. Herbal teas are wonderful for hydration and can make drinking fluids more enjoyable if plain water feels boring. The foods you eat also contribute significantly to your hydration. Fruits and vegetables with high water content, cucumbers, watermelon, oranges, strawberries, lettuce, celery, all help hydrate you from within. A diet rich in these foods supports your skin's hydration naturally. Interestingly, foods with healthy fats also support skin hydration. Omega-3 fatty acids found in fish, nuts, and seeds help maintain your skin's lipid barrier, which is crucial for preventing water loss. So hydration isn't just about water, it's about a balanced diet that includes water-rich foods and healthy fats. Excessive alcohol consumption dehydrates your body and skin. If you drink alcohol, balance it with extra water. Excessive salt can also contribute to dehydration and inflammation. This isn't about restriction or perfection, it's about awareness and balance. Now let's talk about hydrating your skin topically, the products and practices that deliver water to your skin and help keep it there. The key to topical hydration is a two-step approach, adding water to your skin and then sealing it in so it doesn't evaporate away. This is where the concept of humectants and occlusives comes in. Humectants are ingredients that attract water. They pull moisture from the environment and from the deeper layers of your skin up to the surface. The most famous humectant is hyaluronic acid, a molecule that can hold up to 1,000 times its weight in water. Other effective humectants include glycerin, aloe vera, honey, and various botanical extracts. Products containing humectants are typically serums or lightweight gels. Apply them to slightly damp skin. This is crucial. If you apply humectants to completely dry skin, especially in a dry environment, they may actually pull moisture from deeper layers of your skin, which isn't helpful. But when applied to damp skin and then sealed with a moisturizer, they work beautifully. Here's a simple practice. After cleansing, pat your skin with a towel but leave it slightly damp. Apply your hydrating serum or toner while your skin is still moist. Then, within a minute or two, apply your moisturizer. This layering technique maximizes hydration. Occlusives are ingredients that create a barrier on your skin's surface to prevent water loss. They seal in the hydration you've just applied. Common occlusives include ingredients like petrolatum, dimethicone, shea butter, and various oils and waxes. Your moisturizer typically contains occlusives, which is why you apply it after your hydrating products. Understanding this humectant-occlusive relationship transforms your skincare routine. You're not just slapping on products, you're strategically hydrating and then sealing that hydration in. Let's discuss different ways to incorporate hydration into your routine throughout the day. In the morning, after cleansing, apply your hydrating products while your skin is still slightly damp. A hydrating toner or essence can be a lovely first step, adding a layer of water-based hydration. Follow with a serum containing hyaluronic acid or other humectants if you choose. Then apply your moisturizer to seal everything in. Throughout the day, facial mists can provide a quick hydration boost, though they're most effective if you follow them with a tiny amount of moisturizer or facial oil to seal in the mist. Misting alone, especially in dry environments, can actually increase water loss as the mist evaporates and pulls moisture from your skin with it. In the evening, your routine can include more intensive hydration. This is a good time for hydrating masks, thicker creams, or facial oils that seal in moisture overnight. Your skin is in repair mode while you sleep, and giving it plenty of hydration supports those repair